Good afternoon. I'm so sorry. I was just finishing up with my last patient. Took me a little bit extra time, so I apologize for the delay. I'm very sorry. So Dr. Charles and I had reviewed the agenda and we had decided to, I'll help her run the meeting today. So do I have to call the meeting to order, Dr. Charles?
Yes.
Okay, so it's 4:05 p.m. And I would like to call the meeting to order. You wanna
I'll make a motion.
okay. Second? Okay. So, did we share the minutes with all the board members, Dr. Charles? So
Yes.
we should start with, approving the minutes of the last meeting. If everybody had any questions or concerns, obviously we can go through them first, but if not, I would like to make a motion to approve the minutes from our last meeting.
Second.
Okay, second. All in favor?
Aye.
Okay, so the minutes are approved for the last meeting. So the first um, item of order that I would like to review is, the appointment of the chairperson with the departure of Bill. I just wanted to make sure that, I bring it to the board's attention that we would like to have Barb be appointed as the chair of the Board of Health. So can I make I will make the motion. If everybody is in agreement, I'll make the motion for the appointment.
Second.
I don't
Bob.
know if everybody knows Bob.
Oh, I'm sorry. I thought so Barb, please, if you want to introduce yourself, I would
Sure.
probably do justice if I did that. So I'll recommend.
Sure. So I'm Barbara Durkin. I am no relation to Mr. Durkin on this meeting. But I am the interim or the acting Health and Human Services Director. I am also the Drug and Alcohol Director for Lackawanna County. I've been with the county for about 14 years. I'm just in this role as an acting. They are obviously looking for a longer term director. I'm not quite sure when that appointment or when that process will take place, but at this point I am acting. Background is primarily in drug and alcohol. I've been obviously connected to the health department through the work here in Lackawanna County with the Human Service Department. So I'm happy to be part of this in the interim, and then we'll see where we go from there. So that's all I got. Thank you.
So, question, Barb. Have the commissioners asked you to assume the role of chair of this particular board?
So they have been vague on that. So I think realistically, because I'm simply acting, we might need to hold off on an official vote until maybe next month. We meet monthly, correct?
Right.
So
Yes.
do we need to hold off until next month's meeting? I know there are some appointments or some board members whose terms are expiring or have expired. So I know they're in conversation about what that might look like moving forward. But I don't know, Dr. Charles, if we want to hold off on putting me as chair and then maybe come to an understanding for next month's meeting.
And Barrett, if I don't mind, since I run 8 different boards over in our chamber under a chamber umbrella, Robert's rules is I wake up in the middle of the night citing them. Basically, what you can do, Dr. Charles and Barbara, Dr. Sheth, you're vice chair, correct?
Yes.
So by Robert's rules, you can simply, with that vacancy, presume that you would be assuming the position of let's call it acting chair, but simply as vice chair, that you could run the meetings without having to fill that position, because it probably makes sense, as Barbara, as you said, there's a dynamic happening across the board, and if with that in mind, when there's a time for reorganization, and I don't remember from the bylaws if that's on a particular annual cycle, then that can be remedied at that point.
Okay. So we are also reviewing the bylaws. We're gonna send them. We couldn't put it in the agenda because it was too late for everybody to review. So we will send it. Joanne will send it during this week, and then everybody can review it, and then we can vote on it next meeting.
Dr. Charles, do you know offhand whose terms are up?
Yes, Dr. Sheth, Commissioner Chermak, Dr. Shetty, and Bill, but Bill is not here now. It's those four. Mhm.
Yeah, and I did send my the requested documents. I just received a letter signed by I think it was by the district that I need to submit X number of paperwork for my reappointment, which I did submit. So I think I don't know how they're gonna vote on us continuing our terms. I don't know how that works, but I did submit all the required paperwork so that I'm in compliance with our bylaws. I just not have received the official. I haven't received the official reappointment letter.
Okay, that sounds great. And I can follow up on that with you, Dr. Charles.
Yeah. Yeah, I think they sent that letter to everybody who expired to.
Right.
I'm of an age that I wake up every day happy not to get a letter saying I'm expired. So
I think for 2026, so we have time to go.
Well, luckily the letter itself was dated after my expiry date, so I'm like, okay, well, if the letter is later than when my term expired, it's okay.
usually you serve until you're replaced.
Yes. So I'm perfectly fine with whatever you guys decide and guide us on. Obviously, Bob has the most experience on being on multiple boards. Whatever we decide as a team, I'm happy to just continue doing what I'm doing until we have an official word on Barb's appointment.
Yeah, I think that sounds great. Thank you, Doctor.
Thank you. So of course we touched on the update on expired appointments. I know the letters went out and there was instructions on where to send it. In the letter, there was a way to upload it online, as well as there was a fax number, as well as an email address. So what I decided in my particular case is I used all three modes, because with the transition happening, I did not know who was monitoring what sort of box. So I pretty much used all three formats: the online one, the email one, as well as the fax one, hoping that one of them will reach the appropriate person. Any questions on those expired appointments and reappointments? And Barb, thank you for taking it to the appropriate people to review that. So at least then we can get the ball
Yes.
rolling.
Absolutely. And we'll have, hopefully when we send out the bylaws, we can have an update on that information as well.
Okay. Thank you. Dr. Charles, would you like to give us the first application submission?
Okay, so the commissioners have decided to hire a law firm consultant to review all papers that we have done so far during those 2 years, a contract sign, MOU, everything. So I met with them, I think a week and a half ago. They have all those documents. They have to review them. They said that if they have any questions, they will call me, but I didn't hear anything so far. So this is where we at. Everything is ready. The state is ready for us to send our application. We have worked with them. They know that we have everything in place. So I'm just waiting for the lawyers right now, to talk to the commissioners and said that everything seems good, look good, and then for them to sign and then send the application to the state.
Thank you. Anyone has any questions for Dr. Charles?
And I'll just say, I do know that a meeting happened between the commissioners and the attorneys last week, at the end of last week. So they are actively reviewing all of that information. And I do think they intend to get back to Dr. Charles with any questions that they have shortly.
Thank you. Next update, number 7, update on the clinic space on the lower level. Fortunately, I'm part of that meeting personally, so I can provide the update. This morning, Barb, Dr. Charles, myself, and Dr. Linda Thomas CMAC, we met, as a team to discuss that partnership, as well as what the next steps are. as representing the right center, the team at the right center is fully committed to supporting Barb and her leadership and helping through the transition of Bill. We wanted to make sure that we catch up on what has been done and what has not been done. So from what I understand, from an update standpoint, we still have a lease agreement pending with the Department of Health. The reason being that we have not received a full approval from the state as far as co-location is concerned. The state is still not happy with the plan where we separated offices and they took out all the shared space between the right center as well as the Department of Health. They would really like us to be located on different floors. They are happy with the right center moving in and bringing the services on, but from what I understand, they are not too thrilled about being on the same floor, which raises a question as to, because we have case management offices designed for the right center case managers, because we have about 14 case managers coming over as part of the service provision. That'll be on the first floor. The basement level was supposed to be a medical clinic. Half of it we be right center, the other half being Department of Health, sort of roughly. That plan may not work because the state is not very open about that. We have a meeting plan tomorrow morning at 8:30 with the architect as well as appropriate people from the county and myself representing the right center to see what other design changes can we make that may potentially get us in the good grace with the state and get this move forward. So we don't have any other ideas other than it seems like either the right center or the Department of Health clinic might have to be moved to a different floor. The issue being that the first floor where we have case management would have been perfect if the right center clinic was on the same floor. But now the issue is the other part of the first floor is already occupied by, I think, the tax office,
The
correct?
tax office, yes.
So the question will be, is there any other room in the building on any other floor where either the right center clinic or ideally Department of Health clinic can be moved up to that floor, because Department of Health has two rooms. The only issue that we have to remember is one of the rooms that is for Department of Health in the basement floor is that negative pressure room.
Yes.
So that arrangement might have to be moved up, and that room has to be close to an outside wall because the equipment that creates that negative pressure has to be connected from the exterior. So there are some design implications. Obviously, there are cost implications, and we don't have a solution identified as of yet. So we are meeting tomorrow about that as a priority. Dr. Charles, you want to add something to that, or Barb?
No, I think you summarize everything. We need to find a solution, because if we don't do that, the state they said no, they don't want, that the way that we structure the partnership, they don't want that. They want us like to be completely separated.
Any questions? Or suggestions, maybe that will help, because we are at a point, we tried everything. I don't know, other than going to a different floor, which I know is going to be a hassle because the clinic in the basement is almost ready. They were ready to move us in this summer.
Yeah, I had a meeting with them a Wednesday, and they said everything will be ready mid-April. Everything will be done. If they continue moving as is, it will be ready mid-April.
Yeah.
Barbara, you are obviously the commissioners and Brian Jeffers are aware of the situation, I trust.
Yes, they are. Yeah.
Have they suggested that there could be some political intervention on their part to modify this?
So I think we're going to look at the space tomorrow morning and then see if there's any options and then move forward with some potential political interference if needed.
I mean, the only thing I would say is, and these things don't always work this way, but Bridget Kezarowski, being the only nurse in the entire General Assembly,
Right.
Has got pretty strong standing with the governor's office in that regard. So
Yeah.
might be, certainly I would probably start with Senator Flynn and Bridget.
Right. No, that makes sense. Thank you. I appreciate that.
Practically, it does make sense because if any one of you had the chance to look at the plans, there is so much duplication and wastage of resources, like unbelievable, because of these strict guidelines. So, if anything can be done to eliminate that, it will be a win-win for everyone.
Yeah.
You
Yeah,
know, it's
because
almost like we have two vaccine rooms, we have two vaccine
yes.
refrigerators, we have two separate check-ins, and we have two separate, like everything,
Yeah.
bathrooms included. And it seems like there are more bathrooms than exam rooms on that floor.
And what's the state's major objection?
They talk about confidentiality.
Confidentiality, yes.
Yeah, they talk a lot about that.
And the funny part is the clinic that's moving in there is actually a Ryan White clinic. And
Yes.
the confidentiality of that clinic is actually higher than what the state requires because of the sensitivity of patients being treated in Ryan White clinic. So it's funny because if it was a medical clinic coming in there, I can understand their, not that medical clinics are not confidential, but again, Ryan White Clinic is super confidential, and there are several different laws that govern their confidentiality. So they don't want patients from two clinics passing by each other.
Yes.
That really was the sticking point. Which they're gonna pass by each other in an elevator, even if they were on different floors.
Mhm.
So because there was no real common sense to that. Well, we'll see when we meet tomorrow. Hopefully, we can figure out as an alternative plan B. Obviously, as Bob suggested, I mean, best idea will be to bring that level of discussion to appropriate members at Harrisburg. But if they don't budge, even after that, our plan B will be to have a different location identified where one of the two clinics can be moved over to. Not the most desirable option, but at least we'll have a plan B.
Right. Yeah, that makes sense.
The issue is because we are a federally qualified lookalike center, we need federal approval before we can add a site to our organization, and that is like a 90-day process. So until I have a lease, I cannot even start that process. So it's slowing all of us down. So we'll see what we can figure out tomorrow. I guess that's it. I mean, we don't have anything else on our agenda. We're open for any other discussion that any of the team members may have.
Well, if I may, I don't want to step into the political realm, but I will say this, that I think that what Bill Browning was handed by the last administration was a largely unfair situation. He was wearing too many hats. This was just too big an issue, particularly this department, and the almost inevitability that something was going to explode put him in a bad situation. I think he's a good man who tried hard, and I'm not sure what's next for him, but I hope everything works out for him.
I appreciate it.
You know, that's very kind of you, Bob, and I agree with you, and I echo your feelings. I've had at the Right Center, we have had really good time working with Bill, and his vision was pretty clear, and he worked really hard to bring this Department of Health up and running.
Yeah.
So, you know, I personally also wish him all the best for, you know, what he may pursue next in his career. But he worked really hard towards making this a reality. So, you know,
Yep.
thank you. Thanks. We all thank him for that. Okay, well, I will make a motion to adjourn our meeting, and thank you everyone for your input.
Welcome.
Thank you.
You ready?
Thank you. Have a good night. Thank you.
Have a good night. Bye-bye.
Take care, guys.